Suboxone, buprenorphine, and naloxone sublingual film C3 administration instructions. Suboxone film is a combination of buprenorphine and naloxone indicated for maintenance treatment of opioid dependence. It is a sublingual medication, which means that it is absorbed through the veins under the tongue. Before taking Suboxone film, drink some water to moisten your mouth. This will help Suboxone films dissolve more easily. To open your medication package, fold along the dotted line and tear down at the slit, or use scissors to cut along the arrow. Making sure your hands are dry, use 2 fingers, grasp the outside edge of the Suboxone film, and remove it from the package. If your dose is 1 Suboxone film, place it on the underside of your tongue on the right or left side and hold it in place until it sticks firmly. If you are directed to use 2 Suboxone films, place the other Suboxone film on the underside of your tongue on the opposite side and hold in place until it sticks firmly. Try to avoid having the Suboxone films touch as much as possible. Keep the Suboxone films in place until they are completely dissolved. If you are directed to use a 3rd Suboxone film, place it on the underside of your tongue on either side after the first 2 have dissolved, and hold it in place until it sticks firmly. While Suboxone films are dissolving, don't chew, swallow, or drink water because they will not work as well. Make sure your friends and family are aware that you shouldn't talk when the Suboxone films are dissolving because this can interfere with how it is absorbed. Always take Suboxone film exactly as prescribed by your doctor. Indication: Suboxone, buprenorphine, and naloxone sublingual film C3 is a prescription medicine used for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and behavioral therapy. Important safety information. Do not take Suboxone, buprenorphine, and naloxone sublingual film C3 if you are allergic to buprenorphine or naloxone, as serious negative effects, including anaphylactic shock, have been reported. Suboxone sublingual film can be abused in a manner similar to other opioids, legal or illicit. Suboxone sublingual film contains buprenorphine, an opioid that can cause physical dependence with chronic use. Physical dependence is not the same as addiction. Your doctor can tell you more about the difference between physical dependence and drug addiction. Do not stop taking Suboxone sublingual film suddenly without talking to your doctor. You could become sick with uncomfortable withdrawal symptoms because your body has become used to this medicine. Suboxone sublingual film can cause serious life-threatening breathing problems, overdose, and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other medications that act on the nervous system, i.e., sedatives, tranquilizers, or alcohol. It is extremely dangerous to take non-prescribed benzodiazepines or other medications that act on the nervous system while taking Suboxone sublingual film. You should not drink alcohol while taking Suboxone sublingual film, as this can lead to loss of consciousness or even death. Death has been reported in those who are not opioid dependent. Your doctor may monitor liver function before and during treatment. Keep Suboxone sublingual film out of the sight and reach of children. Accidental or deliberate ingestion of Suboxone sublingual film by a child can cause severe breathing problems and death. Do not take Suboxone sublingual film before the effects of other opioids, for example, heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, as you may experience withdrawal symptoms. Injecting Suboxone may cause serious withdrawal symptoms such as pain, cramps, vomiting, diarrhea, anxiety, sleep problems, and cravings. Before taking Suboxone sublingual film, tell your doctor if you are pregnant or plan to become pregnant. If you become pregnant while taking Suboxone, alert your doctor immediately, as there may be significant risks to you and your baby. Your baby may have symptoms of withdrawal at birth. If you are pregnant or become pregnant while taking Suboxone, you should report it using the contact information provided below. Before taking Suboxone sublingual film, talk to your doctor if you're breastfeeding or plan to breastfeed. Suboxone can pass into your milk and may harm your baby. Talk to your doctor about the best way to feed your baby if you take Suboxone. breastfeeding is not recommended while taking Suboxone. Do not drive, operate heavy machinery, or perform any other dangerous activities until you know how Suboxone affects you. Buprenorphine and Suboxone can cause drowsiness and slow reaction times during dose adjustment periods. Common side effects of Suboxone sublingual film include nausea, vomiting, drug withdrawal syndrome, headache, sweating, numb mouth, constipation, painful tongue, redness of the mouth, intoxication, feeling lightheaded or drunk, disturbance in attention, irregular heartbeat, decrease in sleep, blurred vision, back pain, fainting, dizziness, and sleepiness. This is not a complete list of potential adverse events associated with Suboxone sublingual film. Please see full product information for a complete list. To report negative side effects associated with taking Suboxone sublingual film, please call 1-877-782-6966. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.